opioid crisis. There's theory after theory on how to battle it, but almost everyone agrees. It started with those prescribed painkillers and people abusing it. Some say there's a perception that emergency rooms are a major contributor to the opiate crisis.
But new research says not so fast. All new at 6, News 5's Paul Kiska tells us there's still work to be done to get a handle on this addiction crisis.
Dealing with the opiate epidemic has to start someplace, and that place could be your local ER. The new study by the Annals of Emergency Medicine analyzed prescription numbers over a 17-year period. It found 66% of opiates are prescribed by doctors' offices and dentists. It also found prescription opiates like OxyContin and Vicodin originating from ERs fell from 7% to 4%. But there's work to be done. ER Dr. Baruch Fertel from the Cleveland Clinic's Opiate Task Force told me more doctors in the ER and in doctors' offices are now looking for other ways to treat pain.
We need to think about ways to treat pain that are other than giving people a pill, be it physical therapy for back pain, considering something like acupuncture, pressure point injections, and if it has to be opioids, let's use it for as short a time as possible.
Fertel said the clinic's ER only prescribes pain pills for 3 days because studies show even a 5-day prescription is more likely to lead to addiction.
As you increase the number of days prescribed from 3 days, patients have a greater probability of going on to long-term opioid use at 1 year.
Fertel told me other studies show more doctors' offices are also prescribing fewer opiates to get a grip on the opiate epidemic. He said ERs are not the place to get long-term pain meds for chronic pain.
The best place for that to be written, the best venue, is with a primary care doctor or with their oncologist or with somebody who knows them long-term and can assess the risks and the benefits.
Doctors must also get more training in recognizing addicts, some who will fake injuries to get pain meds. That way the doctor can refer the patient to treatment.
I've had patients tell me that they've had unnecessary surgeries that they've convinced physicians to give them so they can get medications. It's truly a disease.
The Cleveland Clinic told me today that opiate prescriptions fell 15% in their ER in just last year. Live in Cleveland tonight, Paul Kiska, News 5.
Okay, Paul, thank you very much. Now hear this. This new discovery could be a huge advancement in the fight against the opioid epidemic. Scientists in Texas have created a molecule that blocks pain after injuries. Acts as a decoy, mimicking the molecules that signal pain in your DNA and preventing pain and inflammation. They say this could pave the way for a new class of pain-fighting drugs that don't affect the brain, so they have no risk of addiction.